Hi, everyone. I want to welcome my good friend, Dr. Dave Gonzalez, for joining us. Dave has worked as an interventional cardiologist in Pocatello, Idaho for, I think it's almost 14 years at Portneuf Medical Center. I met Dave probably 16 years ago when he had a practice in Denver. His wife, Angie, who played basketball at Kansas, was one of my daughter's basketball coaches. And that's how we got to know him initially. And it was kind of interesting. I did a little bit of work with him when I was at HCA. And Dave is bashful to say this himself, but I can tell you he's considered one of the best cardiologists in the country. We recruited him actually to start an interventional program in Pocatello, a city of about 56,000 people. And along with his partners who helped to get that started, they were able to build a program quickly that over the last decade has saved countless lives. He's one of the most dedicated doctors and family men I've ever met. And, we probably became great friends, I'd say, because when you spend time with him, you're really struck by his wit, sense of humor, and charm. So that's probably the nicest thing he has ever heard me say about him. So I should stop now, but I'm glad he agreed to do this interview. So good morning, Dave. Thanks for joining me. Let me begin by congratulating you and your son, Stefan, on being the #1 three-point shooter in the nation this year. Clearly, he picked up Angie's genes in basketball.
Well, you've seen me play basketball before, so pretty obviously he got all his talent from my wife. I will admit that myself. So thanks so much for inviting me to do this. It sounds really interesting, and I'm happy to do it.
Great. Well, my first question, more on the personal side, is how are things with you and Angie and the kids? And is she with you now, or is she with the kids?
The short answer is that everybody's doing well right now. The longer version is that, as you know, Angie and I have 7 kids between the two of us, sort of yours, mine, and ours. So everyone's sort of scattered around the country a bit. If you want me to go through them all, I'll go through them real quick. But Connor and Callie, that's our oldest, live in Kansas City. He's in the food service industry. So as a result, he's laid off currently. And she works as a CPA and has had her hours cut because of this crisis. They are also pregnant with our first grandchild. And as a matter of fact, tomorrow is the online Zoom virtual baby shower. So things, you have to adapt when things like this happen, and we're trying to do so. Sort of going on down the line, Javier, my oldest son, second oldest, I should say, he's a physician. He's a chief resident at UC Health Sciences Center there in Denver, and is on the OBGYN service, which has been fairly stressful for him. And as you know, it's been very, very busy there in Colorado, and they've been hit pretty hard by the pandemic. My daughter, Natalia, who's the oldest girl, lives in Arizona. She's has some health problems herself, but is doing well. The twins live in Las Vegas. They're in the entertainment industry, which requires a lot of travel, ordinarily to New York and Los Angeles and things like that. So obviously right now their ability to make a living has been affected as well. And then currently Stepan is living with my wife in our second home in Las Vegas, which we were fortunate to have purchased a couple of years ago. He was been displaced from UC Davis College, like almost all college students right now because of the virus, and is doing everything online. He's a senior and had his senior season short circuited a bit right before their Big West tournament. But thank you for that lead in there with his three-point shooting. We're pretty proud of him for that accomplishment. And then our youngest daughter, Gabby, is at Idaho State, and she is actually working part-time at a nursing home, which we're very proud of. My wife wanted her to quit and not do that, but she said my residents, that's what they call the people at the nursing homes, she says they couldn't do without me. So she's working hard both in school and at the nursing home. And I'm currently living at home by myself, trying to stay alone here, just to not expose any of my family. So as a result, you can see just sort of our own family and the broad spectrum of how this is, or I should say a microcosm of how this has affected families across the country.
Now, how about you personally? How are you feeling physically, emotionally, professionally? How are things going for you?
Uh, Physically, I'm fine. I've trying to exercise whenever I can. I'm obviously home alone, so it gets there are some downtimes. I won't lie. You can get a little bit depressed being home alone like this, but I have friends like yourself and family that are always checking up on me, and we do family Zoom calls on Sundays. So that's been really helpful. The practice itself has been affected a great deal. All the outpatient stuff has changed to telemedicine, and our foot traffic in the office has diminished by about 70 to 80%. That's affected all our elective procedures, so the hospital traffic as far as procedures has gone down quite a bit. So all the things we see in the hospital right now are emergency sorts of things, which present their own challenges as well. But as far as living home alone, it's back and forth from here to the hospital, trying to keep my exposure down as much as I can. But I will kid you not, it's there's some moments of sheer terror and fear sometimes when I enter the hospital, without a question.
Well, this has been such an unusual couple of months, to say the least. And I know we all see the national news and witness those that are hardest hit by COVID-19, but the national news is focused primarily on the major cities. Pocatello, on the other hand, has been fortunate so far in that y'all have very few confirmed cases, if I understand correctly. Is that true?
Pocatello itself has not had very many confirmed cases, and but as a statewide, I believe it's over 1,000, but the majority of them are clustered around the Sun Valley area, which got hit very hard with around 400 or 500 cases, and I believe Ada County, which is where Boise is, has 400 or 500 as well. In the Bannock County area, there's really only been a handful of patients. The hospital itself has only had one or two patients that have been actually on vents in the hospital. So we haven't, and then there's always at least a handful of patients that are what they call PUI, or persons under investigation, almost at all times. But fortunately, the majority of them have not panned out as being COVID positive. There's also a cluster of people that have been sent home, just like everywhere else, believed to have probably have COVID-19, but are stable, doing fairly well, and so they're sent home and are not tested. But overall, the county here has not been hit very hard.
Well, that's great to hear. Now, I've read a lot about the false sense of security sometimes in rural America, and now that more than two-thirds of the rural counties in the U.S. are starting to experience some little mini outbreaks, if you will, and they're very concerned about that. You all have a good-sized hospital. A lot of these smaller county hospitals have one doctor or two doctors, so that's a little tougher on some of them. But how are you handling those concerns and worries that maybe possibly something's coming to Pocatello and it's going to hit harder? How mentally is that affecting you and people in the city?
Fortunately, I think the local government, kudos to our mayor, were very aggressive in getting the stay-at-home order in place fairly soon after I believe it was within a week or so after the NBA star Rudy Gobert tested positive. So as a result, I think people are doing a pretty good job of following the stay-at-home orders here. Although since we're so rural, you definitely, if you go out for a walk, will see probably more people than you'd like to out walking the trails, and clusters of people that go biking together up the trails and such, that are maybe not quite following the stay-at-home order very strictly, or at least the social distancing orders very strictly. So there's always that worry that we could have an outbreak similar to the Blaine County outbreak, which is, if you're familiar with it, occurred because of a skier that traveled from Seattle to the Sun Valley area and then infected a group of skiers that vacations at ski areas every year and gathers a pretty good sized group of them that all became infected. And so that started a pretty big cluster there. And so the point being that, you know, you cannot let your guard down, even if you're in rural America. And based on what I've seen from the cable news networks and such, they're predicting that it will spread to more rural America, probably more aggressively than you've seen right now. So I don't think there's any way to avoid it, but the hospital here is very well prepared. I believe we have 43 ventilators, which is quite a few.
Wow.
For a hospital our size.
Mm-hmm.
And, you know, we have all the PPE and we're pretty well stocked, although they're continuing to stock aggressively to prepare for this. So I feel pretty confident that we can handle anything that, I won't say anything that comes our way, but we're pretty prepared. And it's every single day we have alerts from the CEO, who has also done a great job, as well as hospital administration, and Ardent Health Services Corporation as a whole has also done a very good job. Just as a sidebar, Ardent does own one of the very hardest hit hospitals in New Jersey. I believe it's based in Hackensack, and several of our nurses from here have gone up there to help. So as of now, we're able to help others, and we're not under a great deal of duress as far as number of cases so far.
Now, when I spoke with my friend Rich, you know, he's down in Albany, Georgia, which has been really, really hit hard. He and some of the other specialists there finding themselves doing things on the front line. Is my assumption correct? You haven't had to do any of that yet. It hasn't been where you had to pitch in to help in the ICU or anything like that.
No, but my partner and I are trying to be proactive and are doing some training on how to manage ventilators, and things like that, just in case. At most of these places, when physicians like myself, you know, maybe GI doctors and such who have not been doing frontline high acuity care in the ICU and maybe don't have those kind of skills, they do courses where they've been doing courses like this, and then they work in teams so that they can handle the things that are more focused on handling the things they can't handle to help the intensivists and critical care specialists to do most of the high acuity care. So we're trying to be proactive, and you know, believe me, it's tough when you're now 63 years old like I am, trying to relearn how to manage a ventilator, how to manage somebody with respiratory problems, how to manage somebody with sepsis, how to manage lines, pressors, all kinds of things like that. So all while you're gowned up, you know, to the T, to make sure you don't get yourself infected as
Sure.
well.
So clearly the threat of this, it sounds like it's really kind of changed your daily routine. Hopefully you're still being able to stop by and pick up your coffee on the way in. It's
yeah,
like,
that's a must. So that starts off my day, and actually it keeps me going in a way, because I've been going to the same coffee place for 14 years. And so I know all the people that work there, and it's nice to see at least some smiling faces first thing in the morning when you get going. So yeah, I do manage to get my coffee before I start the day. So
that's good.
on the days I can't do that, they're not good days.
Absolutely. So now let me ask you, so you mentioned the outbreak and how you believe it happened, or what the rhetorical data shows us in Blaine County. How about, you'd mentioned, I wasn't aware of the outbreak in Boise. Any idea how that started, or is it just one of those things?
I don't know how that started, and I don't know that they know. I kind of keep up with Idaho more so to see what the curve is like and how many new cases there are every day. I haven't really looked at the specific details as far as Boise goes. I did look into the Blaine County one because it was so unusual, because the county itself only has 20,000 people. So, you know, and in my review, I saw that several of the ski resort communities had similar type outbreaks. I believe there was one in Colorado, one of the ski areas, in similar fashion. And it would make sense because you have people traveling there from all over.
Mm-hmm.
And a lot of people don't know they were sick, didn't know they were sick, and inadvertently started the nucleus of an outbreak in several of these ski resorts. And that's how it started in Sun Valley.
Interesting. Yeah, and you and I have spoken offline about some of the reluctance of some regions or some areas or people have of following these guidelines and these orders. What any message you'd like to give to anybody who's watching this about that?
None more so than what's been discussed on all the cable news networks, and Anthony Fauci and uh, Deborah Birx and all of them have pretty much said, Sanjay Gupta, stay at home, and the more you stay at home, the sooner the outbreak, the sooner we're going to be able to flatten the curve, and the sooner we'll be in a position where people will be able to start hopefully going back outside and resuming their normal daily lives. So I'm trying to follow that as well as I can. I think all the healthcare providers have, and hopefully trying to set a good example.
When you guys have heard about things that are in other areas of the country or other parts of the state or region where things have happened and things have broken out, have you and your staff really learned from those situations and tried to say, oh, didn't think about that, we should be doing this? Or what are your thoughts on that?
Absolutely. I think we've learned a lot from, especially within the corporation, on how Hackensack, New Jersey, the hospital there, and I don't recall the name of it, but has handled a massive outbreak where you're seeing, very similar death rates to what you see in New York, and all their, trying to learn as to how they streamline their care, how they prepare to accept large numbers of patients at one time, how they work in teams, and how administration can help, and on and on. And I think all those things we learned from. And I suspect a year from now, you're going to see a real different country as far as how we're prepared for pandemics, because I'm sure this won't be the last one. And this one itself could last, sort of come back in waves, as they have predicted. And so we have to be ready, and we have to do a better job. And obviously the key to this is testing. And as soon as testing becomes more widespread, I think you'll see a marked improvement in how we're able to deal with this virus.
Just out of curiosity, I asked Rich the same question yesterday. What's your opinion on why this has been so much more critically important to go into lockdown than like the last major virus outbreak that we had? What was the
H1N1, which is also known as the swine flu. I think I'm not an epidemiologist and all that, but probably most of my knowledge I've gleaned here has been similar to where you have, which is from a lot of the cable news networks and online. But it all has to do with the R0, or the reproductive capability of the virus, and how many people are infected by one person. And for instance, I believe swine flu was somewhere around 1 or 2 maybe, but I believe it was 1. So, and how it's spread. Ebola, you had to have direct contact with fluids, if I'm not mistaken, whereas this one is aerosolized. And also lives on hard surfaces. And so the R0, or ability to infect, for one person to infect another, is somewhere around 4. Some people say it's up to 6. So if you think about it, one person infected can infect 4 to 6 others, and then those people can infect 4 to 6 others. I think that's been the difficulty, plus the fact that the incubation period is so long, up to 14 days, that a lot of people can remain asymptomatic for a time and be spreading the virus unknowingly. So I think those are the 2 biggest factors that have influenced how this is spread like a wildfire throughout the world.
Let me ask you, we hear so much, you mentioned the news, we hear so much chatter and things going around the news. And we always know there's that element of the quote fake news out there. Does everything that you hear on the news today seem more fact to you, or do you think there's still myths floating around out there?
Well, I think you have to be able to sort through some of the hysteria at times and mixed messages. Or it's difficult because there seems to be a disconnect at times between the president who's seeing the economy collapse before his eyes and all the people uh, trying to balance getting the economy going, which affects a lot of people, as well as being mindful of the what should I say, um, high mortality and high infectious nature of this virus. So to make sure we stamp out the virus, but also try and preserve our economy. So I I think as far as the cable news networks, I think they're trying to do a good job. I think obviously though, if you immerse yourself in it so much, you're going to get mixed messages. You're going to get more confused. So you have to. I try to, if I have questions, go onto the CDC website to get information that I believe is on uh, point and more and truthful, especially when in times when I see uh, things spewing or things being put online. As you know, there's a lot of fake information regarding treatments and things that might work, that might spark hysteria. People maybe trying to ask for medications that haven't been proven to be effective. And also, the answer is I think there are mixed messages on cable news, and it makes it difficult for particularly for the layman to sort through and figure out what's true.
Mhm. So let me ask you, if you would have had a crystal ball years ago, would you have prepared differently, personally, professionally, for what's happening now?
Uh, I think part of the issue is with our particular culture in our country where we're very touchy feely. We shake hands, we hug, and we do a lot of things that maybe in other societies, like maybe in Asia or such, they don't do so much of, and maybe they know something that we don't. So would I do things differently? Gosh, that's a hard one to answer. I think now I will. Obviously, I think society is going to change a bit. People aren't going to be shaking hands and hugging and doing that stuff, doing things like that as readily as they used to. I think what would have been really good, really helpful would be if we had paid mind and paid attention to the prior uh, epidemics that have been sparked, like SARS, MERS, swine flu, that near and Ebola that came to our doorstep but never really affected us as much or as badly as we thought they might, to prepare ourselves for something like this, which has been predicted as far back as 2015 by Bill Gates. I don't know if you saw his TED Talks
Mm.
about this. And there's been multiple people that have predicted a pandemic like this. Certainly, there's been several movies that have shown what could
Mm.
happen. So I don't know how much I could have done personally other than to practice uh, personal hygiene better, I guess, washing my hands and such all the time, not, being careful as far as being around people who are ill and removing myself when I'm ill from
Mm.
the hospital and from infecting others, because as you know, physicians tend to, it's one of those things of badges of honor to go to work even when you're sick.
Mm.
And then unknowingly or unwittingly, you wind up making others sick. So probably my
Mm.
behavior is going to change a bit more now for sure. But in the past, I don't know. I don't know how much I would have changed, but now I know better.
So, what's the hardest part of being a doctor right now in the midst of this pandemic?
Dealing with your fear. I think when every time you go to the hospital, there's an element of fear and anxiety that strikes you before you walk in. You have, of course, you have your mask on. You walk into the hospital, immediately put on your scrubs, and then you put on a hat, your footies on your shoes, a coat, and then anytime you're in a patient room or whatever, you're gowning up and putting an N95. People talk about the N95s, and I'll tell you what, those things are not comfortable to wear. And I can't even imagine being like my son, who's in the OR for hours at a time doing a procedure on one procedure, wearing that. I wear my procedures don't tend to last that long, and afterward I'm sweaty and humid and all that. It's not comfortable. So, but I think the biggest thing is dealing with your own fears, not only for yourself, but also that you could spread it to your family or someone else.
As you know personally, it's been almost impossible to interview and recruit new physicians for several weeks now. In your opinion, how do you think this will affect the needs you were working on as a group or a hospital prior to the outbreak? Or do you think it's going to change that need, or do you think it will go on as the medical staff plan as the medical staff plan?
Boy, it's we're in a little different situation right now because we do have a new physician already signed that's coming in July. And interestingly enough, spoke with him yesterday, or at least my partner did. And he's in New York, and he is very fearful of his family. He's right in the middle of a very bad outbreak at the hospital he's working, and he can't wait to get out of there. So he's fearful for his family. So he can't get here fast enough. We just had another doctor who committed, is going to come, is just waiting for his contract to sign. So fortunately, those things were in the hopper before this all happened. How's it going to affect it down the road? I don't know the answer to that. I'm hopeful that things will return to normal. But however, I will tell you that I think hospitals are under a great deal of financial duress right now. So most of the hospitals, particularly since you're dealing with a lot of employed physicians, most of the hospitals are trying to cut their budgets right now because nobody's doing elective surgeries, nobody's doing elective orthopedic procedures, nobody's doing elective cardiac catheterizations, no elective GI procedures, endoscopies, and things like that. And with the hospital revenues being affected right now, they may be unwilling or less willing to recruit doctors to their hospital, even though before this outbreak there was a need. So I don't know the answer, but I think it's going to have a negative effect on. I think it will have an effect.
So maybe until they get that backlog of things that have been waiting all this time, it may take a while to get that caught up.
Yeah, well, I mean, as an example, our group was recruiting for 3 cardiologists, and I was just told a week ago that we're cut that back to 2. So we're only gonna recruit 2 and not 3. And but I think in a way it's short-sighted because obviously once things get back to normal, hopefully within the next 2 or 3 months, you're going to have a big backlog of patients who are trying to get in, and the referral base is not changing, and so you're going to need those doctors. And how are you going to recruit new doctors in fall? It's going to be much harder. You'll be mainly recruiting physicians who are in practice who want to change. Now, on the positive side, I guess you could say maybe physicians like the doctor from New York are going to want to get out of big metropolitan areas and say, hey, maybe this kind of thing maybe it's safer for my family to be in a more rural area. I don't know, but overall, I think it's going to sort of slow things down as far as recruiting goes.
Clearly, as a physician, I know you're always 100% invested in your patients and the community, but you've also been a businessman and owner in a group, and you're always involved in the business aspects. Do you think I guess what I'm trying to get at is are there things that you guys think you could be doing right now to come out on the other side of this as unscathed as possible?
I think it's more of a helpless feeling that there's not a lot you can do. I think that we have discussed maybe seeing a few more patients in the office to because on balance, uh, I'm sure you're aware of this, but a lot of hospital employees have been furloughed. The ones that are in maybe in the cath lab, in the OR, in places that are not necessarily needed to care for high acuity care patients like the COVID-19 patients and such. And so, since nobody's doing elective procedures and people are staying home, they're not coming in, even if they're sick, they're staying home, that people are being furloughed. So, um, financially, I think the hospitals are going to take a hit for a while. And as far as what we could do to make things better, I think it's very difficult because I think we have to practice what we preach. We can't be bringing patients into the office and like we did before, and they don't have room to social distance, and they're wondering, well, why are you doing this if we're supposed to stay at home? And so right now we're only seeing the sickest patients in the office. They try and keep them out of the hospital, and the others are probably getting very sick and not coming in until they're actually having serious problems. They're coming in through the emergency room. So right now, I think we're pretty hamstrung as far as what we can do. I will tell you though that as far as if you're thinking about this from a you know financial standpoint, I am very thankful I'm not in private practice right now. I'm thankful that I'm in an employed position because, at least from that standpoint, we have a little more security when it comes to um, our um, our salaries and our pay and our ability to provide for our families. Whereas a lot of the private practice places, physicians are furloughing themselves right now and not being able to work, and they're having to lay off staff.
Yeah, that's really obviously a tough time for so many small businesses and doctors' practices. I think people don't think of doctors' practices as small businesses, but they certainly are. Um, I hear a lot of people who don't have the skills or the wherewithal to be on the front lines, so to speak, continually asking what they can do to help, and where can they go, what can they do? What would you say to those people if they asked you?
Hmm. I'm sure there's always things you can volunteer for, but to help with the hospital. But off the top of my head, I don't know what those things would be because wrapped in with that is the fact that if you're talking about lay people, they don't know about how to use PPE, and in the meantime, if they go to the hospital and are trying to help, with patient care, or at least loading patients, unloading patients, or what have you, they're putting themselves at risk. So I just don't. I think outside of helping maybe with food banks and donations and things like that, and helping mainly in your own immediate community of neighbors and such. I think that's about the best you can do, other than
Oh,
stay at home.
yes. Yeah. That's Rich said that yesterday as well. Yeah. Well, listen, that is what wraps up all the questions that I had for you, unless there's anything else you'd like to share with us or say to the audience.
No, I'm hoping that maybe, and after talking to you about this idea you've had about interviewing a lot of different physicians in different parts of the country, I'm hoping this will, um, depending on who your audience is going to be, give people at least an idea of how different things are depending on where you are across the country. And nonetheless, everybody's been affected in one way or another, that's for sure. But I'm hoping maybe at least my little bit here will give you a microcosm of how this affects a doctor who is probably in would be considered to be a rural area for certain.
Well, I can't tell you how much I appreciate it, and I miss y'all, and looking forward to when we can get together again and have some fun. So thanks
All right.
again.
Oh, one last thing.
Yes.
I don't know if you noticed, I'm wearing my Kansas uh, sweatshirt here, and that's as a shout out to my wife, who yesterday was supposed to be inducted into the Kansas Basketball Hall of Fame. And
Yes.
that obviously did not happen because of all of this. So
Oh,
that's my last shout out and the reason I wore this in her honor. So
well,
anyway,
that's very, very impressive. And tell her congratulations, and we'll celebrate soon.
all right. Talk to you
All right,
soon.
buddy.
Thank you.